Hi, my name's Corinne. I'll be your nurse for your 10:40 appointment in room 401. Do you use any assistive devices like hearing aids or glasses?
I don't.
Nothing. Okay. Can you tell me your name?
It's Katie.
Do you know where you are?
Brighton Ave.
And do you know what day of the week it is?
It's Saturday.
Okay, nice. Patient is able to respond to questions, alert and oriented ×3, level of consciousness is normal, and speech is well articulated. Just give me a second. I'm just going to make sure I have everything I need. A pen light and stethoscope. Okay. And if you have any pain throughout this assessment, make sure you inform me, okay? All right. I'm going to take a look by assessing your skin. Feel for it. Pigmentation is consistent throughout the body. Skin feels warm with no excess moisture. Capillary refill is less than 3 seconds, so circulation is adequate. Checking for turgor. No tenting. Hydration is adequate. No signs of clubbing. Nails are smooth and non-tender. Okay. No signs of cyanosis, pallor, no lesions, no signs of inflammation. Okay. Gonna assess neuro. I'm gonna give you 3 words to remember. If you could repeat them back to me and then keep them in mind, I'll ask you a little bit in the future. Gorilla, bed, and tree.
Gorilla, bed, and tree.
Good. Can you smile for me? Can you frown? Can you puff out your cheeks? And can you raise your eyebrows? Okay, so facial, cranial nerves are intact. I'm going to touch 6 different points on your body. Could you just tell me where they are, and I'll have you close your eyes?
Okay. Left shoulder. Right shoulder. Left hand. Right foot. Left knee. Forehead.
Okay, so patient has sensation in upper and lower extremities as well as the head. Great. I'm going to have you stand up, and if you could walk 3 steps forward and 3 steps back. Patient's gait is normal with no swaying or limps. I'm going to have you stand facing me. Can you lift one foot up? And lift the other foot up? Okay. Coordination is intact. What about, can you put your arms out straight and close your eyes? Okay. You can put them back down. Patient passes the Romberg test. Let's see. Can you touch my finger and then touch your finger to your nose in between when I move my finger? Patient is well coordinated. If you want to face that way, can you bend over for me? Come back up. Okay. Hips and shoulders are equal bilaterally. And bend over one more time. Just going to feel along your spine. Curvature is normal. No signs of lumps, inflammation, anything like that. Any pain on that?
Mm-mm.
No pain at all? Okay. Have a seat. Going to assess your eyes. Pupils and iris are round. Eyes are oval and symmetrically placed on the body. Eyelashes and eyebrows are well distributed and symmetrical on the body. Conjunctiva is pink with no signs of exudate or inflammation. Sclera is white, and cornea is transparent. I'm going to do some tests. Can you follow my pen light in? Okay. Eyes accommodate. I'm going to shine the light in your eyes. Look straight at me. Eyes are bilaterally consensual. If you can just follow my pen light, keep your head straight, move it with your eyes. So, patient passes 6 cardinal fields of gaze. Eyes move smoothly and symmetrically. Let's see, I'm going to test your peripheral vision, so just tell me when you see my fingers. Okay. Patient passes consensual tests, accommodating tests, and 6 cardinal fields of gaze, so pupils are equal, round, reactive to light, and they accommodate. Next, I'm going to move to your ears. If you had any issues with your ear hearing or any discharge from your ears, okay. Any tenderness, pain on palpation? Nothing? All right, no pain on palpation. Ears are symmetrically placed on the body and fully formed. That's good, no discharge, inflammation. I'm going to whisper 2 words, one in each ear. Tell me what they are.
Bed. Gorilla.
Okay, patient can hear, words whispered into ears. And do you remember those 3 words I asked you earlier?
Bed, tree, and gorilla.
Yes, very good. So patient has good recall. Next I'm going to assess your sinuses. Any pain?
Mm-mm.
Okay, so no lymph nodes felt, no frontal and maxillary sinuses are non-tender, no inflammation. Going to move to assessing your nose. Any problems, issues with smell, or any discharge from your nose? None?
Mm-mm.
Okay. Can you plug one there and, okay, and the other? Okay. Nares are patent, and they're symmetrical on the body. Head is also normally placed and normal size to the body. Let's see, I'm going to put some gloves on for infection control. Head is proportional to the body. Okay. Any pain, any tenderness?
Mm-mm.
No. Okay. No pain or tenderness on palpation, no signs of lesions. Skull is intact. Hair is well distributed and of normal texture and color. I'm going to assess your mouth. No lesions or dryness on the mouth. Any issues with eating or swallowing? None. Okay. Can you open your mouth for me? Uvula is midline. Tonsils are not inflamed. Moisture is present in the mouth. One more time. Teeth have good dentition. Tongue is symmetrical, and pink is present, so there's no issues with circulation. Okay. Can you swallow for me? Okay, patient is able to swallow, trachea is midline, and thyroid is non-tender. I'm just going to feel for your carotid. Carotid pulses are 2+ bilaterally. I'm just going to listen, auscultate. Swallow for me. No signs of Druitt's, whooshing. I'm going to check your range of motion in your neck. Can you put your ear to your shoulder and to your other shoulder? And can you look to your right, look to your left, your head all the way back, forward. Okay, range of motion in the neck is adequate. Your precordium I'm going to assess. There's no lesions or rashes present, any pain or tenderness when I touch, okay, no signs of inflammation. I'm just going to take a listen to your heart. Listening to the pulmonic, the aortic, ribs point, tricuspid, and mitral. And then I'm going to listen to the mitral and tricuspid with my bell as well. So S1 and S2 are present, so no issues with the mitral or tricuspid. So I'm going to check your peripheral pulses, checking radial pulse, present and strong bilaterally. I'm going to check your dorsalis pedis and your posterior tibialis pulses. Okay, peripheral pulses are strong and bilaterally felt throughout the body. Next, I'm going to assess your lungs. Any issues with breathing, any trouble breathing? Can you take a deep breath for me? Okay, patient's chest is cone-shaped. Lungs expand bilaterally. Patient looks to have no issues or use of accessory muscles. I'm just going to take a listen. Breathe in for me. One more deep breath. Just have you turn around. Breath in and out. Again. Good, and I'm just going to have you take one more deep breath in and out. Okay, lung expansion is adequate, no signs of fremitus. On auscultation, there's no wheezing or stridor heard. Airways seem clear. Alright, I'm going to have you lie down with your knees up. Mind if I take a look at your stomach?
Nope.
No inflammation, no rashes, no lesions present. I'm going to take a listen to each quadrant for 1 minute. Okay, bowel sounds are heard, contour and waves are present. Just going to palpate any tenderness, any pain. No pain is felt. Okay. Auscultate once more to the aortic. Renal. And iliac. Back to the iliac. And renal. Okay, pulses sound good. No issues with blood flow heard. Alright, I'm going to have you sit up. I'm just going to check range of motion, so if you can make big circles with your arms. No pain? No crepitus? Okay, can you move your elbows for me? And your wrists in circles? Feel your fingers. Make a fist. Okay. This elbow. Feel your fingers. And can you make a fist? Nice. Okay, range of motion is adequate in upper extremities. Can you stand up and move your leg for me? Just like this. And again. No crepitus. Can you do your other one? No pain. Okay, sit back down for me. Just going to check the range of motion in your knees. Good. Other one. Nice. Can you roll your ankles for me? And can you flare and curl up your toes? Okay. Patient also has Normal range of motion in lower extremities. I'm going to test your strength. Can you push up? Push down? Can you push up? Push down? Strength is 5 out of 5 in upper and lower extremities. I'm just going to check one thing I forgot. Can you open and close your mouth? Okay, no TMJ or crepitus present.